I am a trained orthopedist and a spine specialist. I've spent many years working in the field of developing expertise on treating patients, managing patients, and working with patients who have spinal conditions. So my philosophy of dealing with patients is to include the patients as an integral member of the team. I try to coordinate and talk with the patient. I try to understand them as an individual. I want to understand what their goals are, what their desires are, and what kind of problem they're having. And I put that together with my basic medical knowledge and my background, and we try to then lay out what the problem is and what solutions and what alternatives there are for management. And I include the patient as a participant in the discussion of how their care will go. My areas of interest and expertise revolve around the fact that I'm a spine specialist. So I deal with spinal conditions, whether they be the neck, the low back, the mid-back area, and try to understand the neurologic structures as well as the bony and musculoskeletal structures. So that's my area of expertise. In particular, I deal with patients who have very complex spinal conditions, which is what I've specialized in over the years. Complex conditions such as spine deformities, scoliosis, tumors of the spine, trauma of the spine, which has caused changes in the structure of the spine, and conditions which produce pressure on the nerves and loss of nerve function. In particular, then, those are the areas that I focus on, and my interests are how can I provide relief of those conditions in the most minimal way possible, such as what we would call minimally invasive surgery, while arriving at a solution for the patient with the least trauma to their body and the fastest and easiest recovery for the patient. At MUSC, and I can tell you my philosophy, we believe in teamwork, and by bringing together a group of individuals who can work together as a team and specialize in the care of the patient, we feel that we can provide the best result and the best solution for the patient. So that's the whole idea of MUSC, working collaboratively, working as a team. There's no one individual that works alone. And I view myself as in sometimes directing the care, but sometimes participating in the care. I have available to me expertise from other physicians who can support what I do, and other members of our MUSC community, especially working in the operating room or working on the floor, where we can provide the patient this care over the continuum of the experience of while they're in the hospital, and they get the best care that way.